Perfect. Hello, everyone. My name is Dr. Nathaniel Berfrank. I'm one of the Sommet Community College directors, and I'm very happy today to have Jessica Duncan, one of the dementia certifier educators from the Alzheimer's Association. And she's coming today to talk a little bit more about the resources that Alzheimer's Association can offer for us researchers, but also the latest tips and researches that we have on the field. We are very happy to have Jessica here today. We hope this is the first of many opportunities, and I'm sure that Jessica, you share with you all the options that you can reach her out after this presentation if you have other ideas, suggestions, or even requests for important resources. So Jessica, thank you again for joining us, and the stage is all yours. Thank you.
You're welcome. Thank you guys for having us. If you're watching this on the recording, this is something that we do through the Alzheimer's Association, and we are able to continue to do these for free with being able to have an idea of what reach we have. So if you are able to email me at jsduncan@alz.org, your first, last name, and zip code, that's very, very helpful for us. And then most of you guys there in the crowd, thank you for putting it in the chat if you don't mind. That's very helpful for us to continue to do these for free. So, my name is Jessica Duncan. I'm the program director for the Alzheimer's Association Iowa chapter. We oversee 99 counties in Iowa and a few in South Dakota and Illinois in the metropolitan areas for free resources to families similar to mine. And I'll share my story a little bit today, as well as support groups across the state. We have over 50 support groups. All volunteer led, and then we do over 150 different free programs like this across the state. So if you ever know of volunteers that are interested in doing presentations like this, if you're interested or you know of someone that would like to be involved, please reach out to us. We would love to give you more details on all the things that we do. We do have 19 walks across the state that help us fundraise to keep these educations free, as well as 4 galas across the state. So we do have researchers that come and speak at those 4 galas, sometimes at our walks as well. And we do have a researcher from University of Iowa that is on our board at the Alzheimer's Association Iowa chapter. Dr. Juliana will actually be presenting along with me on the Thursday, November 7th, talking a little bit about the research that she's finding and also what our national research is looking at this month. So if anybody would like to register for free for that, that is part of a weekly holiday series that will be virtual and recorded. Once registered, you get all the recordings afterwards. And we will be talking about some caregiver navigation information the rest of the weeks through that Thursday series that will be starting this Thursday. So I can always email that over, jsduncan@al. Today, though, we will be talking about healthy living for your brain. So these are preventative measures. These are things that we are seeing research behind as well, nationally, locally, and globally. Learning objectives today. This is about a 30-minute education, so it's not super in-depth. So if you have more questions, just know that everything is on our website at alz.org. The 10 healthy habits is the best way to find more solidified information for this. And just know that most of our resources are available in multiple languages. Specifically, Spanish is the number one resource outside of English that we get asked about for resources. But if anyone calls our care team line, and I'll share that at the end here, we do have 24/7 coverage with master level clinicians and crisis trained individuals that are available in 240 different languages at any time. Their average call length is an hour and 45 minutes. So they're the people that have the time, the capability, and the heart to be able to help anyone from a dementia loved one, dementia caregiver, dementia patient, all the way to people that might be asking questions about memorial checks, research, where their walk is, all of those types of different questions. So just know we do have free brochures that have this information as well if you wanted to share that with your research or anyone that reaches out. So identify how certain behaviors affect our brains and bodies. We're going to list strategies for healthy decision making in the following areas of sleep, smoking, mental health, physical activity, balanced nutrition, cognitive engagement, and social engagement. So, as most of you guys obviously know, the brain is the control center for the body. Over 100 million sorry, excuse me, 100 billion nerve cells or neurons create a branching network. Signals traveling through the brain form memories, thoughts, and feelings. Alzheimer's disease destroys the brain cells. So, depending on the type of dementia, dementia is the umbrella term. So, similarly to when we use the word cancer, there's many different types of dementia. Alzheimer's is the most common type of dementia. And so it's about 60 to 80% of people that have a dementia diagnosis have Alzheimer's. So that's why they're used so interchangeably. But at the Alzheimer's Association, if you look at our tax forms and everything, we're the Alzheimer's Association and all other forms of dementia. So with my dad, he was diagnosed at 53 in 2019. He had frontotemporal dementia with primary progressive aphasia, which is a mouthful, but he had a similar type of dementia to what Bruce Willis and his family are seeing right now. And so that's a more rare type of the disease that happens younger. And so his brain cell death was different than, say, someone with Alzheimer's. So as you get into the science of it, and I am not a researcher, social worker, pharmacist, physician, nurse, or fortune teller, but what I can say is that the differences in the brain are physical imbalances, and dependent on the type of dementia makes a difference on what that cell death or cell brain cell alteration looks like. So with my dad, his frontal lobe and his temporal lobe were shrinking where they shouldn't have been. With an Alzheimer's patient, in very layman's terms, things are in their brain that are not supposed to be there. Plaques, tangles, you can get into more of the things that go beyond that, as well as like with Lewy body dementia, that's a more rare form of it. There are things in their brain that aren't supposed to be there. With vascular dementia, there's been cell death of some sort, most likely after a cardiac event, and so that can happen younger as well. But the number one risk factor that puts our brains at highest risk is age. And so 65 is the magic number that puts us as highest risk. So my dad was really abnormal in the fact that he was under 65, he had a rare form of the disease, and he was male. Females are more likely to have a dementia diagnosis than men because more of us as ladies hit 65 than men statistically. So there's nothing that we really do out of the norm. We just live longer statistically, so that puts us at higher risk. But just in general, this is a little bit about the brain and what we're looking at when we look at healthy measures for the brain. So you'll hear throughout the presentation here, and this is a great thing to share in the community, but heart health and brain health are very, very connected. And so what do you do to protect your heart can also help your brain continue to operate at its best. The brain needs blood flow, and it depends on oxygen and adequate blood flow to work well. It receives 20 to 25% of the blood from every heartbeat. So when we talk about vascular dementia and how that can happen younger, obviously that heart health and brain health are going to be something that you see throughout diet suggestions, exercise suggestions, managing diabetes, and keeping an eye on blood pressure as well. So sorry, this gives away the answer, but Alzheimer's is a normal part of aging. False is the correct answer. Alzheimer's is a progressive and fatal brain disease. Symptoms usually develop slowly and get worse over time. It is not a normal part of aging. In similar time frames or previous time frames, people would just say, oh, it's just getting older, it's within normal limits, hardening of the arteries, they're just getting senile, whatever the case may be. When we truly have an Alzheimer's diagnosis and we see those things in the brain that aren't supposed to be there, then we know that that is not a normal part of aging. Most 53-year-olds do not have a dementia diagnosis, right? So these are things that we want to make sure that we're differentiating between normal aging and what a dementia diagnosis looks like so that we can make sure to get them the treatment or the medication that might be available to them with early diagnosis. So we kind of went over this briefly already, but dementia is the general term that describes problems with thinking and memory that are severe enough to interfere with a person's daily life. We do have a 10 warning signs education and a lot of information on alz.org that goes over what is some of the warning signs for that. If you ever wanted to know what you can talk to with patients, with people in the community, public health partners, clinicians, and these are things that we're looking for out in the community or with a loved one. Alzheimer's disease is the most common cause of dementia. There is currently no cure for Alzheimer's. However, there are drug and non-drug options that can help with symptoms and may have the ability to slow disease progression. Some healthy behaviors may lower the risk of dementia. At AAIC, which is our big conference of the year within the United States, it was found that there are potentially up to 45% of dementia diagnoses that could have been preventable with the research that we're finding out right now. So these 10 healthy habits, whatever you want to call them, are going to be really helpful for those potentially 45% of people that have a diagnosis or could get a diagnosis if they don't make a change soon enough with some of these suggestions. So, like I said, age is the number one risk factor, but obviously genes and family history, environment, and lifestyle all have a key component into putting what that person's risk is into perspective. So, healthy habits may be beneficial for your body and brain. But obviously, it won't change our genes and won't change maybe what we're exposed to in the environment if we're not having any control over that. And so we just want to make sure that if we have any availability to make lifestyle changes that are within our control, we understand that that might not change everything in the first two components that you see on the slide. I will say that genes and family history are not as definitive in someone having a dementia diagnosis down the road as I think most public think. The genetic form of Alzheimer's that is pretty much definitive, deterministic is the word that we use in one of our other educations. It's less than 5% of all Alzheimer's diagnosis. So just know that genes definitely can put you at higher risk, especially if you're over the age of 65, but they're not as definitive as some of these healthy habits that we're going to talk about today. So, story of your health also, this is why they'll always ask you about your blood pressure, blood sugar, your weight and BMI and cholesterol, especially as you get closer to that 65 and when they're doing your Medicare annual visits and making sure to know what is your baseline before possibly having a diagnosis. We do see in some of the high risk populations that blood pressure and blood sugar are really important for us to talk about early on. The two highest demographic groups that are more likely to have a dementia diagnosis are our Black African American population and our Hispanic population. So, Black is 2 times more likely than Caucasian, and Hispanic is 1.5 times more likely. So, we really want to make sure with heart health and brain health going hand in hand that we're keeping an eye on not only these blood pressure, blood sugar, and cholesterol questions, but keeping in mind that that's important for their heart health and also brain health. Right. So, just reiterating basically what we saw on the last slide, many factors that increase the risk of heart disease and stroke may also increase the risk of cognitive decline and dementia. Hypertension, diabetes, midlife obesity, and good cholesterol is good for the heart, and what's good for the brain is good. What is good for the heart is good for the brain. So do know that there are a couple of different studies that are out there calling dementia type 3 diabetes. There is some really good information in regards to those studies. I have a couple of them at my desk that I read over from time to time. I'm doing education with Hy-Vee dietitians here coming up, and they want to learn a little bit more about that. But don't that just because someone has diabetes does not mean that they're going to get dementia, right? So just making sure that we talk about those healthy habits before we have that conversation. It's never too early or too late to incorporate healthy habits. Specifically with smoking, we talk about that quite a bit, and my background's in home health and in the clinical setting as well. And so being smoke-free is one of those that we can see more immediate results than maybe some of the others. But getting quality sleep, take care of our mental health, so that chemical imbalance in the brain, if there is one, obviously is different from the physical imbalance in the brain. Make sure that we're moving. Most up-to-date research from one of our other board members, Dr. Yogi Shah, he's been doing some research with Mayo Clinic from Broadlawns in Des Moines, says 25 minutes is the magic number for increased heart rate and exercise per day. So 25 to 30 minutes we always see, but he said even 25 minutes we can see increased prevention capability there. So, eating healthy, we'll go over the two diets that are best, as long as it's good with obviously the person's physician and health requirements that they may have outside of just trying to be preventative with brain health. Challenging ourselves, so making sure we connect those neurons with new things that we're learning, and then staying connected and social. There are excess slides in here, so if I'm flipping through and someone really wants to read it, just let me know. But it kind of takes a while to get through these and they kind of repeat themselves. So, sleep is essential for overall health and well-being. So, we're really making sure that when we do sleep, the best time frames, and I can't find this study on this, but this was something I had heard in another education through AARP, was that some of the best regenerative sleep times for someone that's not on graveyard shift or kind of over on a different shifting is 9 p.m. to 1 a.m. So if you can get sleep, those are some of the best time frames for us to be in a deep sleep that can really rejuvenate the brain. So we want to make sure that sleep impacts overall health by getting good quality sleep, ideally during those times if we can. It affects our ability to maintain healthy blood pressure and blood sugar, and inadequate sleep can cause problems with memory and thinking. I always use here, obvious, I'm a young mom. I have a 3 and a 5-year-old, and so getting as much sleep as you can, right, is more important. You might have mom brain or forgetfulness from not sleeping well, but we want to try and get the best that we can with the situation that we're in. So these are things that we can ask ourselves or the person that is wanting to make better choices. What kind of environment helps us sleep? What changes might help me create a more peaceful sleep setting? And how can I minimize disruptions? Some tips can be control the room temperature. So my husband likes to sleep in an ice box, so I'm usually cold. But the amount of light is also what you want to talk about, especially if you're night shift or anything like that, getting those blackout screens. Turn off screens before bedtime to help wind down before sleep. I had heard an education last month from a physician in the Burlington area talking about the lights that we see through screens before bedtime, that there are some that are meant to cool down your brain and also ones that are supposed to alert your brain. So if I think it's blue lights were ones that you shouldn't be doing at nighttime because they alert your brain, and red lights you shouldn't be doing in the morning, like your alarm clock and things like that. So you can find more research on that than that, but it's interesting to kind of see what that means for lighting for your eyes and in your brain. And obviously, talking to your doctor if you experience any frequent problems with sleep. There are some studies in regards to some of the sleep aids and things that you can get at Hy-Vee, anywhere over the counter, that actually can be harmful to your brain for taking over 7 years on a regular basis. The specific study was in 2018 from Harvard, and it was talking about ZQuil and NyQuil. So that's something that any of us can get at the, over the counter, but actually we found that very pertinent with my dad. His dementia medicine actually wasn't working because he continued to take ZQuil. And so just really making sure that you look at over the counters. We'll talk about that in a little bit, but those sleep aids are important to talk about even if they are over the counters. Smoking is not helpful for your heart, so it's not helpful for your brain. It's not really helpful for a lot of things in your body, but studies have found that smoking increases the risk of cognitive decline and may increase the risk of dementia. Quitting smoking may reduce a person's chance of developing cognitive decline back down to the level of non-smokers. What could help me stop smoking or stay smoke free? What resources are available online or in my community? We used to talk about Quitline Iowa quite a bit within home health, but hopefully they're still in existence. So they did have support systems with that Quitline, talking to the doctor about if there's any medicine that can help you with cessation and looking for cessation programs. At the home health that I worked for, we actually had a Medicare covered smoking cessation program that we could bring to adults. So if you ever wanted information on that, I could always give that out. Mental health. So, obviously, yeah.
Jessica,
Can I ask a question about one of the previous slides about, did you say that if people quit smoking, they can actually reduce their risk of dementia down to the level of people that didn't smoke or don't smoke?
Yes.
Okay,
Let's find that
I
slide.
just wanted to make sure I understood. Because that's a pretty powerful, um, like stimulus for quitting smoking for people who may not be interested, but then when you present it that way, they might think about that twice, maybe, or something.
For sure. So, quitting smoking may reduce a person's chance of developing cognitive decline back down to the level of non-smokers. So,
Yeah,
I know
yeah.
we used to see that in home health when I would do education, in the home and things like that too. Also for heart health, you could see that immediate response within 20 minutes of quitting, if I remember correctly, from their curriculum. So obviously continuing that outside of just the 20 minutes. But it's pretty interesting to see how much it can have pretty quickly if someone has the capability to stop.
Jessica, just enjoying this opportunity that we stop in this topic. Do you know if you have research regarding vaping and the impact and the risk for dementia?
I am not aware of it, but we have over 1,100 research studies going on right now, so I
Oh,
can definitely check into that and let you know.
yeah, it's something that it seems very interesting nowadays. We don't see only high risk for teenagers, but we see older adults like vaping as a way like to quit smoking. But we know like so many side effects and respiratory tract. I was wondering if we have impact in dementia or risk prevention dementia. So
Yeah.
it would be nice, like, if you can reach out to us later, like, if we have anyone studying that, just came to the top of my mind.
Well, and that's always been of interest to me too, because, obviously you hear about secondhand smoking. Is there an impact with secondhand vaping or, those types of things too? So let me see what I can find out and I will definitely email you for sure.
Thank you.
No problem. So mental health is obviously different from dementia. So, sometimes I was just doing education with the police department on Monday, and they said this is for our mental health training. And so I make sure to back up and say, okay, mental health is a chemical imbalance in the brain. Dementia is a physical imbalance in the brain. They can go together. My dad had a depression diagnosis along with the dementia diagnosis, but we look at it very differently when we look at medications and putting medications together to help the brain in those two different ways. So mental health and self-care obviously is preventative to make sure that we're doing the best for our brain before. And obviously, if we do have a dementia diagnosis or we're a caregiver as well. We do find in the state of Iowa that 27.4% of our caregivers for dementia patients, specifically 65 and above with Alzheimer's, say that they have a depression diagnosis themselves. So our caregivers, we are definitely seeing a spike with depression as well as chronic health conditions. So 60.8% of our caregivers in the state have a chronic health condition themselves. So we definitely want to make sure that we're doing caregiver education as well. So take care of your mental health, pay attention to your stress levels and any symptoms of anxiety, depression, or other concerns. These affect the health of your brain, and many healthy habits contribute to good mental health. So we do want to make sure that we're talking about this because I got to actually be a part of a research study through Iowa State University. And as a caregiver, they wanted to know what my stress levels were, what my cortisol levels were, and what that meant for my health down the road. So I know that locally we've had an education or a research study on that. And then through University of Nebraska Omaha, I got to help with another stress level test for caregivers. That was with my sibling. So, what is the stress level with siblings that are trying to take care of a dementia loved one, and what does that mean for our health down the road too? So, just know if you've never looked at research studies, we have 6 in the state of Iowa, and they are looking at not only what can be the ultimate cure, but also for caregivers and stress level too. And hi, Kimberly, if you don't mind putting in your first, last name, and zip code in the chat, we would much appreciate it. So take care of your mental health. What are some things I enjoy doing? How can I build breaks into my day? And how can I focus on self-care? So with my dad, and this is being kind of vulnerable, but I think it's helpful to share. I was able to actually talk to my physician about being eligible for therapy that was covered under insurance under a diagnosis of adjustment disorder. So with dementia, you obviously lose that person time and time again. And so that was a really good resource for self-care for me to be at a point where I could talk about it in front of people, be able to navigate my 5 and 3-year-old through it, and be able to say, this is something that I'm doing for myself so that hopefully I can be the best caregiver for my loved one. So, that's not for everyone though. So, self-care can look like taking a nap, going for a walk, dancing, singing a song, bake a treat, read a book, watch a funny video. Massages was my other thing that were really helpful for me to kind of do some self-care. So that's good for any type of thing, but also brain health. And I know I'm getting close to my time, so I'm trying to move forward. Get moving. So physical activity can improve brain health. Like I said, 25 minutes has been the most up-to-date Iowa research that we've seen. And Dr. Yogi Shah released that in December. So if that's changed since then, I apologize. But what science tells us is that consistent cardiovascular activity will reduce risk of cognitive decline. Physical activity may directly benefit brain cells and reduce other risk factors. And for most people, any increase in movement can have an impact on overall health. So something that we're moving, moving your desk or you're standing, whatever the case may be, can really help. So thinking about what activities do I want to try? Obviously, not everybody is supposed to be doing HIIT classes and hiking and, all of those types of things, but what's something that gets my heart rate elevated? How can I build more physical activity into my day? And who can I ask to join me? So joining each other can be really helpful for one of our other healthy tips that we'll talk about with socializing and keeping connected. But make sure that we find things that might already be a part of your day, like walking in the neighborhood, going to get the mail, whatever the case may be. And then start small and work your way up and try something fun for you and your friends if you can have that accountability. This is probably what people ask me about most, so healthy diet. So I don't have all the answers, but I can definitely share some things that are good for general heart health and brain health. So nutritious food is fuel for the brain. Obviously, eating a balanced diet may reduce your risk of heart disease, cancer, Parkinson's disease, Alzheimer's disease, stroke, and diabetes. So this is good information overall for those different chronic health conditions. So like I always say, make sure that you talk to your doctor before you take this as, the Holy Grail or anything like that. But the DASH diet and Mediterranean diet are two of the best because of the omega-3 fatty acids that are in a lot of the suggestions within this. That's really, really good fuel for your brain and really helps out the most. So what do you guys think is the number one fruit that is best for your brain?
Apple. I've always heard like berries, like blueberries.
Blueberries, good job. Yes, so blueberries have lots of antioxidants in them. And actually, Dr. Shaw is doing IV infusion with 12 patients. He was getting another round of 12, so maybe 24 now. And he really encouraged them to take blueberries too. So even if you are going through treatment preventatively, blueberries are really good for you. What is the best protein for your brain that has the most omega-3 fatty acids in it? Any ideas?
Salmon or walnuts?
It's a fish. Oh, it is
Salmon.
salmon.
Salmon, good job. Yes, so salmon is very, very high in omega-3 fatty acids, so that's going to be the best protein, and then blueberries are your best. Uh, and I get a little bit of pushback with this, but for vegetables or healthy fats, avocados are really good for your brain. So trying to incorporate avocados can be really, really helpful too. So, also thinking about your cooking oil, there is avocado oil or olive oil that you can utilize. They have different smoke levels too. So if you're grilling versus in your house or things like that, obviously keep an eye on the smoke degree that you need. But that would be better for you for brain health than butter, lard, those types of things that are pretty common to use to give that flavor. But you can find flavor in different ways. And then focus on what you can add in, such as fruits, vegetables, dry spices, those types of things to give it flavor versus fat that might not be as healthy for your brain. So we kind of talked about this when I said talk to your doctor about over-the-counters, vitamins, minerals, but this is the World Health Organization that concluded in 2019 that vitamins and supplements should not be recommended to reduce the risk of cognitive decline and dementia. So my husband's a pharmacist. He's asked all the time, should I take this? Did they tell me that this has calcium in it? You know, these different aids. Always talk to your doctor about it. Majority of the time, as a pharmacist, they don't see a lot of benefit from those things that you see on TV with TV ads. So obviously always talk to your pharmacist or your doctor if you have questions on that. And still talk about vitamins and supplements because some of them might offset different medications that you already are taking. So challenging your brain can lower the risk of cognitive decline. We obviously saw a big uptick of this over the COVID year, months, whatever stage it was. And so we really wanted people to be able to continue to challenge themselves. So going through an education, learning something new, learning a new game. Sudoku is actually one of the best games for your brain. So if you're looking for something you can do today, you can download a Sudoku app. That's really good. And I always encourage people, we actually do brain health bingo. Bingo is really good for your brain as well. If you're going to do something that maybe you don't know how to play bingo or something like that, that would be a good thing to learn. And it would be able to help you be social as well and stay connected. So keeping your mind active forms new connections. Cognitive engagement encourages blood flow to the brain, and mentally stimulating activities may possibly maintain or even improve cognition. Engaging in formal education may keep your brain healthy and can provide protection against developing dementia. So if you can go to, a non-credit class or something and learn how to incorporate that food into your diet or cooking class, that would be an example of something that might be helpful for you too. Learning a new language, learning a new strategy, like in the game chess or anything like that, are great examples. All right, staying connected. So connecting with others socially can have many health benefits. We definitely saw an uptick in dementia diagnoses over the COVID years, especially with the inability to connect in person and things like that. So I think that's probably stabilizing now, but we're able to see more research of it now, obviously being years in the past. But staying socially active may support brain health. Social engagement is associated with living longer with fewer disabilities, so social engagement is really helpful. Those who feel well connected tend to make healthier choices in other areas of their life. And so these are some tips. So actually volunteering is really, really healthy for your brain. So longevity reports are showing that if they have volunteered for certain amounts of time, they're actually living longer. So if you ever are looking for an organization to volunteer with, I know of one that would love your help. So we definitely love having volunteer opportunities and helping people with brain health prevention to kind of put our mission where our mouth is. So schedule regular phone calls or video chats to keep in touch. My grandfather actually does a pen pal program down here in Council Bluffs, and so he's a senior that pen pals to a third grader, and it's just the cutest thing. So that was his way of doing something connected with people over COVID, and there are programs across the state like that too. So if you ever want to do a phone call tree or anything, they do have them through the area agencies on aging usually. Visiting friends, participating in events in your community are other examples. This is just in summary, kind of what we went over today, and obviously it's recorded, so if you want to watch it, you're more than welcome to. And then, like I said, we have free education and opportunities at alz.org. This is that care team line I was telling you about that's available in 240 different languages, so if you wanted to put this in your phone, you're more than welcome to. It's 800-272-3900. Like I said, they're available 24/7, master level clinicians that are crisis trained, as well as they have the time and capability to have an hour and 45 minutes calls. So they're great. And if it's a local need, then they'll contact me and I can take it from there. So, and you'll never talk to a robot. So just know I've called them 4 times. No robots, no nothing, real life people, really, really nice people, I promise. And then I told you about our 50 support groups that we have across the state, as well as other community educations. The research one is on the 7th. You could find that at communityresourcefinder.org or alz.org/CRF, and that's a partnership with AARP that we have. All right, a few minutes over, but any questions, comments, things that I didn't go over that you wish that I would have. Besides the vaping study, I can definitely get back to you on that.
No, you did great, Jessica. Thank you so much. Thank you, Barb just joined us. We are recording this session, and our goal is to share among our members anyway. Jessica, I would like to know if it's possible to have more details or more knowledge. You mentioned that we have currently 6 studies being conducted in the state of Iowa through the Alzheimer's Association, right? Is there a way that we can at least have the names of these studies or the researcher, the PI of these studies? I think that would be very interesting for our members to know what is going on here in the state of Iowa and maybe a way to collaborate with them. I don't know if all studies are being conducted at the University of Iowa, but even though like our goal is like to go further the boundary of the University of Iowa and collaborate with others in the Iowa state. So do you think that it is possible for us to make this connection?
Yep, definitely. I can send that to you in an email. Some of the studies are much longer than I can memorize, so
Oh no,
I
no
will
worries
definitely
at
get
all.
those
No
to
worries
you.
at all. If you have like just a title and I think a short description and the PI, I think that our members will be very happy to know, how we can collaborate and reach out. And our goal as a community of scholars is to promote these connections. So I'm very happy having you here today. As I said, like I hope this is the first time that you have you, but we are looking forward to have more opportunities to talk to you. Definitely, you have a lot of knowledge in join a lot of educational sessions. I just emailed Juliana asking her if is it okay we can share about this opportunity of the educational session this Thursday among our members. We'll be happy to do that and share the link. I imagine that we have other people interested as well. And as soon as I get information about the details, I will make sure that we share with our members, Jessica. And I just want to reinforce, if you have anything that you think that will be beneficial for our group, our goal is to make this connection stronger. Our goal as community of scholars is to engage our scholars, and our scholars come from the College of Nursing, but other colleges as well. We go across the university and the health departments. So we have here Ai that just joined us today. She's a visiting scholar from Japan, right?
Right.
We are very excited for having her. I think you'll be here for 1 year, right?
Yes, 1 year.
Very excited for having her. And she's from the public health college. So we have members of the College of Law, College of Dentistry. So it's a very broad community. And I believe that we can join you and partner with you, as well as we always participate. I say always, but at least like 3 consecutive years in our Alzheimer's walk. Always looking forward to expand the number of participants and spread the news. So it's very nice to closing the loop today this year with the Alzheimer's Association participation. I don't know, anyone else has any questions specific to Jessica regarding her presentation or topics? I understand that Jessica can be our point of contact, especially about a research that is being conducted not only in Iowa, but through the Alzheimer's Association in other states that we might want to connect with. I think that she'll be a great resource. She brought a lot of topics here, especially about health prevention. I love that you brought a lot of research and what we have been investigating recently. I don't know if anyone else has any questions.
Can I ask a question?
Please.
Sorry. Hi, I'm Ai Izuka from Japan. Yes, please call me Ai. And I have a question about stay connected. Staying connected. You mentioned that phone call and online communication is effective to reduce cognitive decline. But I'd like to know about, is online communication or non-face-to-face communication is effective to reduce cognitive decline, as is this same as face-to-face communication? Are there any research or studies?
Yes, I am not familiar with them right now, but I can definitely look into it. There should be if there's not. Because I definitely hear that from the community of, well, yeah, staying connected is important, but that face to face is so much more important. So let me see. I'm not familiar with any right now, but if either way, I can email Dr. Oker if that's okay, and then
Yes,
let you know kind of follow up for that. But it's a very valid question because
yes.
we've had really good input from locally for doing virtual education. So from our perspective, what I do on a daily basis, I've actually seen really good results from the Iowa community, our rural community, with virtual and kind of jumping on board with that. Whether or not research is basing that post-COVID of whether or not it's preventative for brain health, I just don't know. But I can definitely follow up with you and see if we find anything because I think it's a valid point. So, and I apologize, my neighbor's dog is freaking out right now, so hopefully you guys can't hear it in the background.
No,
But
we can, no
okay,
worry. That is a
okay,
great question. Thank you. Yeah, that is a great question, especially like what the COVID poses, like many nursing homes like could not have visits, so the patients were just having FaceTime or any other type of web communication. So we don't know how much that influence and the risk for dementia or even like the aggravation of the case. So that's a good question.
Thank you very much.
That's very good. Okay, if nobody else has any questions, I just want to thank you, Jessica. I know like we are a little bit extra time, but we are okay on our end. I hope like we are not overlapping any of our appointments that you have right now. I really appreciate your time today. I will keep in touch. I will be communicating with the members all resources that Jessica will be sharing with me based on this meeting today. Thank you so much. Jessica, you're free to stay with us. We should have another topic for our agenda. Otherwise, just feel free, okay? I will stop to record right now.